Hi, please, I've come to say this. If you are pregnant and for any reason the doctor says that your blood pressure is high, there are two things that could be happening. It's possible that you have what we call pregnancy-induced hypertension or pre-eclampsia. If your pregnancy is above 20 weeks, that is about 5 months and above, and there's elevated blood pressure detected during screening or routine blood pressure check, please, you see, leave the hand of a quack, leave the hand of a maternity home. You need to be in the hospital. Why I say that? If you have what we call pre-eclampsia, that pre-eclampsia means that your blood pressure is high. Not just that it's high, there is also what we call proteinuria. There is protein in your urine, and this protein in your urine could be that your kidneys are being damaged. So if you have elevated blood pressure and you have protein in your urine and you are still being managed by a quack hospital, quack maternity home, where you have untrained nurses, just those that have learned how to deliver, may be putting the life of your baby and your life at risk. When you are told that you have pre-eclampsia, have two types. It can be mild pre-eclampsia or severe pre-eclampsia. However, the cocoa be say that severe pre-eclampsia can lead to what we call eclampsia. You start convulsing in pregnancy or immediately you have delivered. And when it gets to that level, it is the higher level that will start struggling to save your life. Now, if you are pregnant and you are told that your blood pressure is high, especially when your pregnancy is almost due, the best things the doctors will advise is that we are going to terminate that pregnancy. What it means that we'll start processes for delivering that baby. But if the pregnancy is removed from term, that means it's still far away from due date. Most times we'll see the level of your disease and see whether to still conserve that pregnancy till that baby matures or will terminate that pregnancy. That depends on what we see. However, if you are not in the hand of the qualified practitioners, the obstetricians, you may be in trouble because the people you are visiting may not know what is wrong and what is not. They may think, don't worry, you deliver like the Hebrew men, especially in this in this part of the world where people want to just deliver like the Hebrew women. Those Hebrew women delivered safely. What the most important thing was that they have a healthy baby and a healthy mother. Now, if for any reason you are told that you have severe pre-eclampsia, it means that the blood pressure is so high, very high, and that you have more than two or more pluses of protein in your urine, there's a problem. We need to terminate that pregnancy, especially if you are due to term. We'll give you some drugs. We'll call magnesium sulfate. We'll constitute it. Here's the way of constituting it. We'll constitute it. And that will help you not to fit. It will help you not to have convulsion. That convulsion is called eclampsia. Eclampsia is convulsion from pre-eclampsia. I'll call it eclamptic fit. When the person has developed eclampsia, a lot of things are already going on in the body. The person may be bleeding into the brain and will have stroke, cardiovascular accident. So a stroke may happen still after the person has finished convulsing. You see one side of the body is already one side of the body she cannot move one side of their body again. And if she's still pregnant, with each of the convulsion, it's tonic-clonic, involving the whole part of the body, the baby in the womb will be suffering anoxia, asphyxia, and when you deliver that baby will become asphyxiated. So this is why you should visit a good hospital. Now, if you are told you are going to deliver that baby, whether it's any route that you are told to deliver, please don't reject. Discuss with your obstetrician and find out the best option for your baby and yourself. However, if you come early, we'll be able to salvage everybody and everybody is fine. We'll give that drug, you may not fit. But if you had started fitting before coming, we'll start looking for how to save you. Sometimes we'll give you just that magnesium sulfate and you are fine. However, most times, because you have convulsed several times, the convulsion will not stop. Even when we have given you that magnesium sulfate, reconstituted, gave the one we give for breakthrough seizure, and it still does not stop. We'll have to give another drug to stop that. Convulsing before visiting the hospital. For example, if you have delivered and you are convulsing, when you come, we'll try to give you that magnesium sulfate to stop the convulsion. There's a way we'll reconstitute it. It's not something you can do on your own. So we will reconstitute it and give you. If the magnesium sulfate does not stop it, we'll give the one we'll call for breakthrough seizure. If it does not stop, we'll go higher above to give you anticonvulsant. However, a lot of things might have started going wrong. Your platelet, the one that helps to clot your blood, the platelet might become dysfunction, and you will start having low platelets that you will start seeing blood in your urine. Your urine will become like coke colored. You start, when you give injection, you start bleeding from that places, and you start trying to save your life. We start going for fresh whole blood, cryoprecipitate, or fresh frozen plasma. These two, the cryoprecipitate and fresh frozen, are very costly. In this part of the world, it goes for between 350,000 to 500,000. Imagine that, what could have been prevented. And not even that, your livers have started malfunctioning. You have elevated liver enzymes. And with elevated liver enzymes, you have low platelets, and you are hemolyzing. Your blood is constantly destroying itself just because of those effects that you had, that you were not managed properly in a good hospital. So please, this plea is for every pregnant woman, every husband, every brother, every boyfriend, or every girlfriend. So far you have a woman that is close to you that is pregnant, share this video to them. We want them to visit the hospital whenever they are pregnant. Thank you. Especially if you are told that your blood pressure is high, do not take it lightly. It may be dangerous for your health and that of your baby. My name is Dr. Adazion. I'm an obstetrician, gynecologist. I discuss everything about women's health, children's health, and sometimes men's health on my channel. Please subscribe, follow my page at Dr. Adazion at OBGYN Talks with Dr. Adazion. See you next time. That's my way of giving health awareness. Thank you.